Good morning, everybody. I hope you're having a good day and that you are warm wherever you are. Feels like winter out there again. Got my book here ready. This is the new book for this year that has all of the new products in it. And one of the new products that we are talking about today is see if I can get it to where you can see it there, Peppermint soft gels. And I have one pulled out here. You can see that it's frosted. And if you have had any of doTERRA's other peppermint or soft gels like the Tri-Ease and the Copaiba, this is very rigid feeling compared to their normal one. And you can tell it's not shiny. It's got a little bit of frosty texture to it. And there's a reason for that. We're going to talk about it. So it comes 60 to a bottle, and that retails for $24, wholesales for $18. So you get $6 off with your wholesale membership, which is a good deal. And this is an answer to digestive issues that a lot of people face. So, the intestinal tract is made up of the small intestine, right after the stomach, and then the large intestine. The small intestine's primary job is for absorbing nutrition from the food that has just worked through the stomach. And the large intestine's primary job is elimination. Now that's in broad general terms. And we frequently have upsets in both parts of the digestion, the small intestine or the large intestine. Many studies have spoken to the efficacy of peppermint essential oil in dealing with those issues in the digestion. And I just want to talk about four in the book here that are listed. So all the way back 1979, there was a study done that said peppermint oil in enteric coated capsules was found to relieve symptoms of irritable bowel syndrome better than a placebo in patients suffering from IBS. Then in 1997, patients with IBS symptoms who took a peppermint oil formulation in an enteric coated capsule were found to have a significantly higher reduction of symptoms compared to patients taking a placebo. And then in 2001, children suffering from irritable bowel syndrome who received peppermint oil in enteric coated capsules reported a reduced severity of pain associated with IBS. And in 2007, in IBS patients without bacterial overgrowth, lactose intolerance, or celiac disease, peppermint oil was found to reduce IBS symptoms significantly more than a placebo over 8 weeks. And also for nausea, capsules containing 2 drops of peppermint oil to cancer patients during chemotherapy cycles was found to reduce the intensity of nausea when compared to the control group. That was 2013. 2003, peppermint oil was found to be as effective as buscopan, I think that's how you say that, an antispasmodic drug at preventing spasms during a barium enema in the colon for X-ray imaging purposes. And then digestive aid. The use of rosemary, lemon, and peppermint oils in massage demonstrated an ability to reduce constipation and increase bowel movements in elderly subjects compared to massage without oils. Indigestion. Patients with indigestion, treatments with capsules containing peppermint and caraway were found to decrease pain and pain frequency. That was 1999. And in 1996, an enteric-coated capsule with peppermint and caraway was found to reduce pain and symptoms in patients with non-ulcer indigestion compared to the control group. So lots of studies have been done. Hey, Jackie, thank you for joining me. Thank you, Janelle, for joining me. And so one of the problems with getting peppermint to the intestinal tract is that it has to go through the stomach. Topically gives a measure of relief, but it can't deliver all of the essential oil potency that is needed because your body metabolizes it differently since it's passing through the skin. And taking peppermint essential oil internally before these capsules were created had two main drawbacks. First of all, for many people, when the capsule dissolved in the stomach, it created a sensation much like heartburn, and I am one of those people. So when I have an upset stomach, I typically do not take peppermint oil because it feels like it's burning in there, and I know it's not. It's the menthol being released out of the capsule into my stomach, but it feels like that. So and the second thing is that the menthol, which is the chemical constituent that we need to get to the intestines, doesn't make it through the pH of the stomach. So those are the two main challenges. So doTERRA has manufactured an enteric-coated peppermint capsule specifically to get the essential oil to the intestines where it's needed. Now, enteric is just a big fancy scientific word that means it's got a hard case on the outside that will not dissolve in the stomach, so that the menthol makes it through the stomach acid and is delivered to the intestines where it's needed. So, recommended dosage. Adults, 1 to 2 capsules, 30 to 60 minutes before every meal. Children, age 8 and up, 1 capsule, 30 to 60 minutes before every meal. And I see Janelle says she loves her peppermint soft gels. That's great. She takes one every morning. I'm glad they're helping. Very good. So some random facts that I learned, which I didn't even know. So this, you'll see it says Mentha pepperita on there, which is peppermint. Peppermint is thought to be a naturally occurring hybrid plant between watermint and spearmint. I didn't know that. I thought it was a species that has always been around. And it has been around for a really long time, because dried peppermint leaves have been found in the tombs of pharaohs in the pyramids. And the Ebers papyrus, which dates back to 1500 BC, lists using peppermint for digestive upset. So tried and true method from many years ago. So if you haven't gotten them yet, and it seems like something that might be of benefit to you, be sure to put it in your shopping cart for next month, or maybe this month even, if you haven't done your order yet. And this is my last video because of Christmas and New Year's. So I will see you all in 2020. Have a great day. Bye-bye.